Dr. David Agus joins us now to unpack some of the things we just heard in Ben's report. First, David, can you tell us what is a protective glow? That's number one. Number two, the president says that he is immune and that he can't get the virus. It's been reported many, many times that you're not really immune after this. So can you set the record straight? Protective glow, and are you immune? Is he immune?
Protective glow, I don't know. I mean, I guess you know it when you see it. You know, your body has two ways of giving you immunity, making antibodies and making T cells. The antibody tests that we have now look for the presence of antibodies. They don't look for neutralizing antibodies that actually give you immunity. So there is no antibody test for immunity at the present time, and the T cell test is very difficult to do, and there's no talk that the president actually had that done. So we don't know he had immunity. That treatment he got of monoclonal antibody cocktail did work, will work for about 3 to 4 weeks in terms of protecting an individual, we think, from the virus. Although, again, that hasn't been proven in clinical trials. So he probably has some immunity. How long it will last, I don't know, but it's very difficult to say definitively, I have immunity.
In fact, the Lancet Infectious Disease is reporting the first case of reinfection. What does that say to you in this country?
Well, now there are many cases of reinfection in the country. This is a very well done, molecularly documented case that's published. But, you know, it's critical that immunity lasts for a certain period of time. And we don't yet have a test to know how long that is in an individual. The hope is that a vaccine will last for years. When you have the virus, we think you have several months of protection in general across the population. Some people are shorter, some are longer, but the hope is much longer with the vaccine.
The other thing that's confusing, David, for a lot of people is the president is refusing to say that the president says that he tested negative. The White House doctor is not saying that. The words he's using is the president is no longer considered a transmission risk to others. Is there a distinction between the two statements?
You know, as it was written as such, one assumes that there may be a positive test. And realize that after COVID-19, when you're not infectious, you can still test positive because the test looks for about 30 letters or the 30,000 of the virus, and those are fragments the test is detecting. So it's very difficult to know if someone is infectious or not with the current test. We still need better and more appropriate testing in the country.
All right, Dr. David Agus, thank you for your time this morning.